Brethren, we have in our midst our specialist, by name Dr. Nana Sapon Seth. He is a specialist obstetrician, gynecologist, and reproductive endocrinology, and infertility fellow in training at the Kolebu Teaching Hospital. He also practices as a specialist at the St. John's Hospital and Fertility Center in Accra. He has over 20 years working experience in the health sector, and today the Lord has appointed him, prepared him to come and teach us about fibroids, the myths and the facts, the things we have heard, the things people have said, people have shared with us, and what the books also say or what science also says. Doc is here to share that with us. And I believe the Lord has prepared him enough for this day. We will say a short prayer even as Doc prepares to join us. So we are committing ourselves and the session into the Lord's hands. Want to be one we Yehovah de one bile. Nile di enche ba kono fe no num eko egbe. Ino ni etwe anna mimba aha wo fe ye Yesu ba mi. Ye tu ye ho ahye Erade nsa Erade ankasa mbefa mre yi no hu. Ne wahyefa ma ye no oma ye nsanka enhye ono nko ani di ani onyam. Ye bompa ye so onfa doc mu Dr. Nana Sapon Seth. Erade mfa ni mu no mfa nye ne dwuma ema yen emma aye wo Mount Calvary Cross Ministry na ewie no ye de anyunya no nyina ma ne din ewo Yesu din. Amen.
Abusiafo mechiachi amu nyina sede ma me kan no ye frame Dr. Nana Sapon. Me a specialist obstetrician gynecologist at the Kolebu Teaching Hospital and also specialist at the St. John's Hospital and Fertility Center. And currently I'm also reproductive endocrinology and infertility specialist fellow in training at the Kolebu Teaching Hospital. So I would try, I don't know the scope of my audience, so I do very well in Cree and in the English as well, so I will speak both Cree and English so that actually majority of people can understand what. So today, please, can I be heard?
Very well, Doc, please.
All right. So today, as the topic indicates, we'll be dealing with a very important topic, fibroids, the fact versus and the myth. So we go through the introduction, then we look at what is a fact, then what is a myth. Then we look at brief anatomy of the female reproductive system and the location where fibroids are located in the uterus. Then we look at what is fibroids at all. Then why this conversation is very important to us, that this evening we have to be listening to this. And then who is at risk of fibroids in the first place? Then what are the common signs and symptoms of people with fibroids? Then we look at burden of uterine fibroids globally and in Ghana as well. Then you look at what are the public health implications of fibroids, and then how do we diagnose fibroids? What investigation do we treat? And then the treatment options. Then is there a way that we can prevent fibroid or reduce the risk of getting fibroid? Then of course, we look at, after having understood everything, then we now look at what are some of the facts and the myths of fibroids. Nafe, Yade, Adicheno, Abe, Ebiye. So a way of introduction, we said uterine fibroids are also known in the medical jargon as leiomyomas, and they are the most common benign tumors of the female reproductive tract. And fibroids affect up to about 70 to 80% of women by the age of 50 years. Then about 70 to 80% of women, majority of them will have fibroids. And the highest prevalence and disease burden occur among women of African ancestry or descent, including we, the Ghanaian. And then also, fibroids may remain asymptomatic. Any fibroid no nim kra se onwo bi age se ebia ye okoye scanner ana scanner beka se obi but about 25 to 50% affected women develop clinically significant symptoms including heavy menstrual bleeding so onwa fibroid obi oha onim se obi nso oha about out of those who have it about 25 to 50% ombenya bibi to say on se ombu on sa moja ne ba bebre obi oha na ya se betima ye ne ya obi on so otimi Johnson entem enyen Johnson entem ni nyina na ye ebia diabetes ebia fibroid no is pushing against your bladder so it can also cause pressure symptoms and depend there be a fibroid ni si wa with them no ebetimi ama amanfo so affect on fertility and obi on so there be a fibroid ni si onyemo ana say what we call the recurrent pregnancy loss and then has also got other obstetric complications and impair quality of life. So continuation in Ghana and many parts of the sub-Saharan Africa, numerous myths and misconceptions persist, including beliefs that fibroids are caused by spiritual attacks. And you can say, you share bibi mamni afe Ghana ha, you bibia enye no kre, but you can't say ya no kre. Ibinum saman for face a fibroid cry a spiritual attack, and always yenya abusiafo no abusiafo nyina will be on the baby will be that one, and then inevitable will be our fibroid be on to and then of course fibroid can permanently flash out, and we take so what come will be tone drew, and now we are better TV so a doctor say we draw. So far, let's transfer out of the fibroid from your system. These are some of the myths which today we are going to look whether they are true or not. These misconceptions frequently delay diagnosis, encourage inappropriate treatment, and contribute to preventable morbidity. And if you want Ghana Health Service, well, most say, and some amount for better television sooner. Radio sune otika mu a on kafa fibroid ho a ebianya no kre no eno nti ebi wo ha o bi kra on fema hospital ntem ana wanya treatment a betimi ama abrenase ana se asobo no the audit ho that's why this presentation today is very important. So consequently, distinguishing between scientific fact from myth is essential to promote early diagnosis, evidence-based treatment, inform reproductive decision-making, and improve women's health outcomes. So this presentation therefore reviewed the current evidence on uterine fibroids while correcting the common misconception using the latest international guidelines and Ghanaian public health recommendations. In the FSC said, the most recent evidence, and the most are internationally and locally accepted, and no correct through do fibro, and no neck, Yebeka Hansen. All right, answer ye befitting us here. The topic is fibroid facts and myths. So, if you say, you can't say be a fact, no cry as such as a myth, and so as such. So, by definition, a fact is a statement that is true, can be verified, and is supported by scientific evidence and observation and reliable data. Whereas a myth is widely held belief, it can be a story or idea that is false, inaccurate, or not supported by scientific evidence, though many people may believe it is true. So the aperture is a cassette. Bibi and okra factor, and yes, be a and okra fibroid in Semuno. A bibia about the Munyan san for the Yashim Yaya research. Yajiatum said, we're supported by data. And a cassa bibi so ya mefa. A bibia and okra, but Yakasa among four physicists say and okra. And she and nona and so that's in a short put that will be the difference between fact. So when we use the word fact, we know what it stands for. And then when you use so the purpose of a fact, it helps people to make informed decisions about their health and well-being. Whereas myth may lead to fear, delay health care seeking, poor decision making, and unnecessary treatment or harmful practices. So facts are supported by evidence, as I've said, and myths are supported by beliefs, people's beliefs. So therefore, making healthcare decisions based on facts rather than myths, it leads to earlier diagnosis, appropriate treatment, better reproductive outcomes, and improved quality of life. So that's why today's presentation is very important. See, this is not a typical anatomical, but it's a better so if you look at diagram A, you see that that's a typical anatomy pictorial of the female pelvis. So you could see the urinary bladder and on a Jones term, and then in front you see in between the urinary bladder and the rectum, you see the vagina. That's where that's exactly where it's located. And then you could see the uterus bend over. So that's why, depending on the location of the fibroids, if the fibroids are too huge, they can be sitting on your rectum. And this, in some people, they may present as constipation. And if it's also too big and it's sitting on the bladder, then of course, it's also going to cause the frequent urination and others. Now, it's very important. Look at the anatomy here. Look at the B. We have the vagina, we have the cervix, that's the aodienano. Then we have the body of the uterus. Then we have the atungosu and the friend ovary, no, and a chips, no, atungosu abato, you know, a friend of fallopian tube or the oviduct. Good. So now, look at the B, second.
Doc, please, I would like to quickly translate in Ghana and then we can continue. Don't mind.
Oh, that was nice. I wish I could speak as well. All right, thank you very much.
All right, thank you so much. You're welcome. And you mean, I find Doctor one way fibroid funny. It's one only fibroid. It's one only anoquale can only men susu akashin a fibroid noni ke back a bonifi ni asana. Agbene hue honey one nutrition. Akashin kake fact be noni moko efe research science ana akashin ene nekeni force nekeni oba na ake fibroid ni neke alo gbenene no atron ni akesona ni kaka metu ebe meko me asusumo ani ameyo ye hilahi ni ameko me ni ehani wonu sisun ho akeka fibroid je trofakobe alo shipon trofakobe ni obanyonu ni eba hani fibroid abahu dabi sin science befa alo ni kasemo befa anna boni ba se ni abanye aso fibroid na agbene ho hani wonkwe ye wo reproductive system emi one only hani ofi oyowe na kan reproductive system chon wo mi okwe o screen no bia na mfoni ani kan onine abakungbe hani wonu sisun akashin ye wo formoni ye dani waye noni atronle fallopian tubes ni here formoni ye fallopian tubes na abuhu aye ovaries niji wolo ni you know every month doc hani wonu shishin akeshin fibroid ke ba eba ya ofomoni emi agbena hu heni eba ya ni eya jenshin ye alo heni fibroid ba kan ba je noni hela ba je po yo gbomotro eni ewo mokoye eshamo mlamla ekole ni je diabetes ki fibroid eka eshamoton ewo no hani eshamo mlamla na kanye moko hu ye eka rectum me tafla chejame ni ke wobaya ni amie excuse me, fair Tony, Ejok, what a fibroid, a kanja make a cagbene, honey, almost which be almost a wa, a cagbene, or nyani, or ya near me. A walk or yet fibroid, ne can be near whom ni ekeba. Doc, please, you may continue. Thank you.
Thank you, ma'am. God bless you. All right. So we've seen the normal anatomy of the female reproductive system. Then please, let's kindly note, when as we let's look at diagram B. As we move from inside out, we have main 3 layers of the uterus. We have the innermost layer where the baby normally baby plano bed out the endometrium. And a muscle, the body of the uterus, I would smooth muscles, and that's myometrium. And a chireno, serosa or perimetrium. And fibroid no ye name no according to baby is into I would the picture na will be no ye call the next picture now the way to pictures are in our fibroid being that's the normal anatomy of the female reproductive system. So now let's see how fibroid can occur locate in this. So we have picture A and B. So we name the fibroid according to where they are located in the uterus. So we've seen the picture of the uterus and then the reproductive system without the fibroid. So if we look at A, let's start with A. We can have a giant fibroid that was sitting baby at Aquarano Bedano into a friend that one intracavitary fibroid. And on who says baby a fibroid need down picture A and picture B so the same thing pedunculated submucous fibroid. And the wall fibroid not found at here, it's reserved. The Wutimium cry, Aquarano yin on a fibroid ninty, a bit when you miscarriage. So these are some of the fibroid that can cause miscarriage or because of the fibroid no emanu intimicra enyim. Now yenko the submucous one. So the submucous one no picture A no be mu the friend say no push ko awodie ni mu. Eno the substance so ni say omo submucous fibroid no omo ne moja tu on pa into one is wo bu on sa emoja ne ba bebre obu ho a on ba hospital say emoja ne ba bebre kra say the be say no untimi kra use sanitary pad into use diapers ebano eno ne intercavitary fibroid any submucous fibroid. These are the 2 fibroid that cause most of the heavy menstrual bleeding and all the that some of them will come their homogeno arecra because of the submucous fibroid that is causing the bleeding. And when you go to picture B, you can see another pedunculated submucous fibroid. And no, a free would be anymore befa service num says there at the vagina num ye hunu be da ubuova a mobile moje tuno or moje tuno over pass the friend is speculo back then on the friend prolapse submucous fibroid. So it's a better urbanum vagina and also a cause problem and so on. Now for the except the body of the fibroid and on the friend intramural fibroid. And no say and so be bra a mappy on banner accidentally and normally say and so on obey me the o man in area operation be a submucous intramural fibroid and so be bra and no and time hygiene but say esubebra eventually diagram A na one it will actually encroach in the endometrium say esubebra and then your problem. And now we have subserosa no so diagram I don't see I would cry more often than not no and also so hard dream P say esubebra and hard dream P bet me the say S1 ubet me say there na mama church muchre no. It is a war and usual some serosa fibroid, non pedunculated fibroid. Ubuoha say or pedunculated fibroid na a sumpa year. So on your one, a baby 24 weeks, 26 weeks, no. Now I would pushy pedunculated fibroid, the see fundus, no. I would honor. And now after the diaphragm, the ultimate moment, now a pushing with your no sano, a buoha, a virgin at home. untimi hume fibroid ninti say ya hwena untimi hume na consistently hanwa na je say ye twa yinsen so. So these are some of the things that the pedunculated fibroid can cause. And then you could see different types of the pedunculated fibroid. Some of them can be actually, in our settings, in Ghana here, some of them can be very big. It can be very big, extremely big. Now, for Yensha, subserosa left diagram B, you know, so what you when you should be inclusive, baby, I'm actually on left, you know. Ube who say, curse and some be more. The medical no air pass no so mbehu wo mo ha ubehu se matron left e wa ha na ubehu se subserosal fibroid we no we ni tubes no a enkwabo no sperm no be fam ana se wutun nkosua no wa ha nso so a na we no akire nkosua no na sperm no wa be hia wa ha no wa form akola wi a so wenti we no se esunsa na broku tube we a e kire se tubes we no entimi yadwuma fibroid depending the location I you know e betimi abroku say tubes we I guess you operation you answer as tubes we e betimi we can depending where it is no be operation awie no na say tubes we there na asay no enti fibroid sun so no say you move from say diagram say we name fibroid according to the location within the uterus. There, so based on that, we have the submucous or intracavitary or the endometrial polyps. Then we have the intramural fibroids, then we have submucous fibroids, and we have subserosal, and then we have the pedunculated fibroids. And then, depending the case here, any babies, you know, as soon as so, all right. So,
can I quickly translate that in Ghana and then we continue?
Yes, please. Thank you.
Thank you. When I find a Heshibami doc, honey, one of Shishiaka fibroid, fair I am in Srotui, Nigbania Kahale, a Jeheni fibroid, your ye, for money me, Ecomen, come for money me, Henny Fanny, Kaji, or Hiamusua, be foul be ye baka, Nika, or yana fibroid, Konakaye. Eba balaka shin obana musun keke eche no musun ehu aye ekole huni eka formoni eke agona thing ewo muscle setting alo setuntu ni no hu enyo ha ni mo lahuo mo wa de nche ni ekohu enyo egbe oshi keke ba ka formoni na abutuntu ewo moko ba ni ba ke langhole be ni aba aka speculum ba wezi ni aba kwe aba na aka shi fibroid e ka e form ni na abu tuntu dani aye ekomenhu ni enyo e ka form ni no ewo no na ke ko he musu e oba na aka shi musu e ba da hu ka she he ko tamo 24 weeks kan ya agba na keke e chi fibroid e kan ya wen ewo ka fe na kan diaphragm ni ha ni onyo omu ojogba keke eti diaphragm keke ko mu lungs enye agbelu ojogba ewo ka fe na kan onyo omu ojogba keke fani atrio na ye hospital doc le hu wi akashin fibroid aye ekonklume intramural fibroid neke no eko ye ni eda chon no eka fi eka formoni agbona agbe to ye ni eda chon obaye no ke for bi fe shike ya dape no eka fani baba ni onye ofo obi aloko hia musun e ba fite ani aye ekole hu ni echele subserosal fibroid no neke ekta fallopian tube deme ewo kaji kafache aloka oke ohe fatalo nabole ni sperm say ya miti wolo ni efe ya bifalbi alo baby e forme fani baby a move kection fallopian tube mi keka gbene ya ho formoni e mi die nche heni e ba daye ko ye ne ke subserosal fibroid na ekwe ni fallopian tube hewo baby enye amu na kaine ya kamusuni emi ewo no hu ba anya ni ehani onyeni ufo. Doc, please, you may continue. Thank you.
Thank you. All right. So I think with that point, so if the subserosal fibroid is not, as you can see from here, is far away from the tubes and is small, then of course it might not have any impact on your reproductive system. So we have majority of ladies, when we do scans, we see some of these subserosal fibroids and they get pregnant, no issues, and then it doesn't impact, negative impact on their life. So it depends on the size and the location that may be impactful. Right. So now we know where the fibroid can be and within the location of the fibroid within the uterus and the impact it will have on the individual. So the important question which everybody is waiting for is what are fibroids? So we said uterine fibroids, also known as fibroid, the medical jargon, leiomyoma or myomas, simple. They are benign. They can be benign and yet cancerous. Monoclonal tumor. It can be a tumor. Engineer said that the control mechanism of your body is no longer can control it. Monoclonal tumor that arise from the smooth muscle cells of the uterus, myometrium. See, so the uterus, I would muscles ne woman and a friend is smooth muscles. About the munyansani, I who said these smooth muscles, emuna fibroid, it's me done a fibroid. So, and you say, yabobi. So, this proven scientifically. Fibroids are the most common benign tumors of the female reproductive tract and affect women predominantly during their reproductive years. Fibroids are, and the size of the fibroid, they depend. We have different type of, as you say, sorry for the interruption because I'm still in the consulting room, so my patients are waiting for me. So from time to time they come and I have to tell them I'm doing presentation. So forgive me. All right. So we said fibroids are the most common benign tumors of the female reproductive tract and affect women predominantly during their reproductive age. And fibroid now normally you be who says say we do menopause no more normally I would be on fibroid and time how on fibroid how on pa ne on dream on timi on ma boom that what we call the reproductive age. It's only ma boom na fibroid no it's mean on fibroid pa the unya edru menopause we are na fibroid no so how cry best shrinking very soon you be the reason why is so and na fibroid no so no it's it do why is kete cry and no how to a very big one. And we can at times some of them are really big, others to just tiny one. And then it can be some of the uterus to just a single or two, and some of them to I've done operation whereby I've removed over 200 noodles. 200. We count. At times we count at the theater, we get to a certain point and then nobody is interested in counting again. And some of them you go in and it's one or two. So it can be single, multiple, and it can be actually be many, and it can be small, and it can be giant fibroid. And the location is if you have different locations within the uterus, as I've already indicated. So understanding fibroids, we've already seen the intramural fibroids and then what they can cause, and then Madam have given us explained it to us. So we said the intramural fibroids they develop within the muscular walls of the uterus, and then they can cause heavy menstrual bleeding. And memoja man or baby, that's depending the size, and it can also produce pelvic pressure pain, and then distortion of the cavity from the diagram I show, and the affect, and also depending where it's located, it can also distort the endometrium. Baby around the barbedano and a bit me again. And we've also seen the submucous fibroids. We said they normally call the heavy menstrual bleeding, and the intermenstrual bleeding. Ubebu nsa bebree say ubi o ha oba o si moja no ubu nsa ba bebree say I just will use diapers, or you can't use the sanitary pads. So some of the more often than not, ube you should not submucosal fibrosis no, and a bebree no a deba, and also do a ubu nsa we are in between no, who say the moja no baby. Submucous fibroid can also cause that, and depending on the location, can also cause infertility, and as already indicated, recurrent miscarriage, and then also maybe a mobile frame marker IVF as them. So IVF ni board in kakra, into so be say fibroid ni be na when you now call IVF no, a bit me ama miscarriage, and I said ama IVF no, and yes successful. In the answer, IVF amobi. You make sure say we need submucous fibroid and I said what you call the uterine polyps. They are not there to affect the implantation. Because the implantation, I said and you say no, a bit me a gina I would do now at me a form the placenta. Now placenta let me feed the baby noir from day 1 up to when the baby is at term and the baby will come out. Good. All right. Then we'll talk about the subserosal fibroid.
Translate and then we continue.
Yes, please.
Thank you. Doc, it's wrong on only fibroid. It's wrong catching fibroid there, a conclude leiomyomas, allomyomas pe. Nika call your fibroid there, jake or your cancer. Agbene huwe ejinoko ni ebanya eyanoni eda ni ebaye smooth muscles amin. Itron wakashi fibroid many amena ekoji ye ni ameshe amefomo be amni. Itron wakashi many na menopause alo ye ni na menopause egba amena atron agbene hunke ameye kopoe enyo enogbo. Niji ni ena menopause. Itron wakashi ekomen ye bibio ni egba mona ekomen huwe enyo afio agbo ni egba mona ekomen mokoye kebana ode ekomen ni ka emusuni emi moko huwe enyo ba leti ni itron wakashi ewie hu ake FA fibroid surgery ni eje alo operation ni eje fibroid ekome 200 ye mokomemi ewo fibroid mokono ekome mokono enyo mokono hufa babao etron wakashi fibroid ko ye hwe mekome na ni eha ni lahu ama hu wakashi sanitary pad alo pad ni wo use wo ni wo kesi oye ani mo enye use no eko eja keke fe la ba hule ni ba fite efe ewo na kangbeme be kome ame use diaper alo pampers ni amewo amekesio no amekesio ye ani ehani wonu hihwu hu ake enyo efa ofomona akeshi teni eba ajehewo onyeni ofo no komehu ni ewie ni ehehia waji akeka oye fibroid bepi afumu ni abaste IVF ahabu eja akeshika ase ahabu bile eni sani eya ni eya petition ni enye efisio jogba ni eda ni na placenta ni ba hale ni eni koyo ni ba mukeni enye ni ebale na kan eja akeka efe na kan be fibroid ehegbe ni ekpene alo ehagbe ni beke anye appetition ni efisio ni enye da. Thank you, Doc.
Thank you. All right, so we've looked at subserosal fibroids and then their implication over there. So at times too, we saw it in the pituitary display there. Some of the fibroids too, we have what we call cervical fibroids. And on a fibroid, they see was I would Now, what was the cervical fibroid ni bia? And no, your friend be dyspareunia, and it's no, say what was cervical, any papi on was cervical fibroid, no, so only obey ya on tise, while I say a yon ya. So no obey shia to why I see your yan and a brofum, our friend with dyspareunia. So I don't say, will be on your bed fibroid is the awodian anunti. Or no bear may see na Nasiania. Anna, baby is seen because we've seen the anatomy, the location of the urethra and the bladder. So it can also cause urinary obstruction. And when the fibroid is there, one of the indication for CS, as far as fibroid is concerned, is what we call lower uterine segment fibroids. So the fibroid, the baby is, a block of baby. Akolane befa ba eno no a strong indication for CNT. So what fibroid na ye star mawo na wonyam ye ka say oh fibroid no is service no abroko kwan ba bi akolane befa ba ndie ye no be ka say enunti esi your operation man. So the fibroid to in a situation whereby it becomes an indication for CS is when it's lower uterine segment, and in a situation at times I would know how on my hospital or better if your fibroid will be any, but ABR, baby or one chief center cry into Yango one where Timian Wako 9 months in about fibroid or a block baby a clan befaba, but with him. And she said, I won't canwa because of fibroid no air block holinty, Emma Aklan Emba. It is a no say Yango one. Yentimian rational be drew hospital in Temwa. A terrible cry, I would dear no, a bit me up pie, I would any pie, a colano bit me a wood, emergency bit me a tuno. Amanti, depending on the location of the fibroid. Fibroid can cause difficult labor, obstructed labor, and it can also be an indication for cesarean section, challenging difficult one. Okay, all right.
So quickly translate that.
Okay, thank you.
So, Doc, who area about cervical fibroids. Ni etraka shika yo cervical fibroids ye bolena momi bana ke ben he wa koye cervical fibroid no ji okadi komeni ubanyo na gbene hu ke ohwie nu bana ke ewo he bekomeko onye ni ohwie nu kra ja ke fibroid ekibe ni samonye aba agbena hu koye fibroid na ko cervical fibroid ni ario na he ko enya ha ni koye afọ bodi enche usmo no for ewasio alo ewa ewo ke bale na kanye aha ni bodi enche o for doctor ba ake fani afebu sie no pe jigbe no ni ba choni obanyo fo hwehwehwe ke opene no na kanyo hia ni fomoto here agbene be ebanya ni ehani ofomo ni adwa ni gbeke ayakan musun emi keke gbeke ejimi no di ni bi kome ni doc to we here. Thank you, doc. Please you may continue.
All right. Okay. So now we've seen what fibroid is and then how we name fibroid according to where they are located within the uterus and some of the infect that or the complication that can arise from depending on the location of the fibroid within the uterus. Now, the popular question that or what everybody wants to know is fibroid cry and the back. That's what probably is in the minds of everybody. Everybody wants to ask fibroid cry and the back. So we now look at the causes or what also cause also means etiology and the pathophysiology of the uterine fibroid and the back. So as you can see, the exact cause of uterine fibroid remains unknown. Ebepumone, the adipotin and the fibroid ubia enim, and their development is considered enema and namniama bebre. So says our body munyansa namia who say and namniama bebre so ana it increases remember ubia fibroid, but the NCA fibroid unyam the manibano. The exact cause is remains unknown. However, it involves complex interaction between genetics. Said here, unyango from boy any your friend hormone, say chemicals in a way, any other molecules, any baby yet any baby you find yourself the environment and other your lifestyle. It can predispose a bit young and crofobia about it. Some of these things can, let people drop. So the genetic, hormonal, molecular, environmental, inflammatory, and lifestyle factors can contribute to people generating. So fibroid growth is promoted by ovarian steroid hormones. We've already seen the ovaries. You hear the reproductive system who said ovary no aside say all tunkusiano the emma obema oba ye oba enumuno na say hormone chemicals no ovary no so eyebi. Now some of these chemicals now ovary no no and your friend estrogen and progesterone. So the estrogen and emma oba and a progesterone also as the name progesterone and on the boa onyamwa and on the hormone a boa magnesium ejina and until the friend progesterone a magnesium ejina. Now homo abodium nyansani abodium enhwehwemu akyerɛ say these two hormones estrogen and progesterone and na a boa ma fibroid enyini and untina we intina say unya menopause uja unsa bua so what fibroid ni bi kra eye ketwa and this will be enya ne menopause where this 60 years now our fibroid kesia we are worried because we think that there's more to it because once you go into menopause, the reason why you've gone into menopause in the first place is that your ovaries are no longer producing enough estrogen and of course progesterone. That's in the first place. That's why you've gone into menopause. That's why you've gone into menopause because you are no longer producing adequate estrogen. And it's when you're menopause, not fibroid, no, egusu yekesia, and they're not and yet just ordinary fibroid. There's something to it. So when we see some of these things, we become worried, and then we try to investigate to know what is causing somebody who is in menopause and still is having a fibroid. Indeed, is it fibroid or is it something else? So Yahoo said hormones are my fibroids no enyini pa na body estrogen and progesterone. And a baby estrogen and progesterone say we are about every party through a ovaries. So the DNA actually fibroids no dia though the exact cause is not known, but we know from research that it's a hormone-dependent tumor. And one of the hormones that indicates is estrogen. And what does estrogen do to the fibroids? I am intentum, cellular proliferation, fibroids intentum. And it's also the estrogen is also a boama, progesterone also a juma. And it's also increase the growth factors and all because something angiogenesis. You bedrow says here, the entire or fibroid na you operation moja too no because fibroid no to a tumor into one also oba also a pen blood vessels ubenya emoja a free and more on to bet me ayekese. So and so the evidence as I've already indicated the express estrogen a buama fibroid and the evidence research HSM fibroid the ontimiyekes during your reproductive and now we are bumuno and a fibroid and which is a certain which we produce more of the hormones estrogen and fibroids usually shrink after menopause because after menopause you are not producing estrogen and progesterone in that much quantity to cause it to grow. Then fibroids and also BM said answer now ube starting what group puberty and now starting a boon air column no hormones no estrogen ni progesterone no do no and yet do Inti or enkola totofewa sano. Hardly do we see fibroid enkola totofewa on why because in them too the level of estrogen is also low. So as this I was starting a boom cell every na udu umpeni eswa ana fibroid no is sitting out here. So basically fibroid mostly people between from 30 years going back. We can have people below that in their 20s and they have 1 or 2 fibroid nodules in their uterus. Okay, then we also talk about progesterone. So
translate this one.
Okay.
Thank you. If I know me, doc, honey, or when be comeni, no, it a fibroid bar. If we are catching fibroid there, no copotem be ni ali akeshin ikeba. If we are catching be comeni ni banya ni ehani muku aneko. Area genetics ni jila minsani. Area hormonal, a trauma cashin hormone say no G no ni honey you feel you. Ni honey one nutrition wa cashin war utrum ya lower environment. No honey be ni your environment ni hu banya ni e honey one fibroid neko a low boni wa hioshu ha lifestyle ni be ni wo feel ni wo you. Whether I won't say exercise, lower say exercise can I kind be a say banyani a honey muku and then a fibroid neku. A reaction ovaries near tron way and for near me benny what you see. Hormones in your alloy producer hormones in your niji estrogen ka progesterone ni ha ni you feel you. Estrogen ni ha bo nibi ni yo heni ha ni anaka yo jibu ni progesterone ko hia musu no jino ni hia musu ka ya shibe ni ubafo hani wonu sisi akashin na kani bi enyo ne hormones enyo ne estrogen ka progesterone wa ni fibroid cell da wo ke moko ena menopause alo ebote menopause ni keke fibroid ke mo ye fibroid ani ebote ni o ba na ka gbe na fibroideboin so ejake na kan be ami estrogen ka progesterone ni gbomotre produce or ifa ni ba hani fibroid ada because menopause be ambi ni o fibroid ni da be no ha ni amehawo fio ejakashi e ba anya ni efe no konklo ha ni wol nutrition akashi hormone say no ni poten ni amefio ni ha ni fibroid da e ke cell proliferation ni akashi cells ni ba ni ha ni fibroid fi or fibroid wa ni na kan cell said da oya agbene ho ha ni progesterone receptor increase or progesterone ho a receptor anyo etwu ni ojugba angiogenesis na ha ni wonu hihia kashin kaji ona fibroid dey enche na afaje ni ha lela ni eda ni noe estrogen ni ha ni ibale na kan ni ha ni wonu hihia kashin no ni woni ni bi ni ase ni ha ni neke hormones ne affect or fibroid and no ehani anakashi hormones say affect or fibroid fibroid be mi ni oblai ya be ami no ba nyo for oba na akashi na kan be ami ni fibroid da ni track na kan be ami ni o produce estrogen ke progesterone or fibroid nyo idamlamla agbene ko menopause ni fibroid onyo produce estrogen ke progesterone no jugba ke fibroid boy somo ni hani woni hihia kashi kaji moko edakotron ehye be ni ba anye for na kan gbeme amena fibroid tron ona na kan gbeme akashi ameye fibroid alo gbeke bi ni ameye ko 20 ke ya 30 ameye ko 30 ke ya aka ameye ne ke fibroid hila na eko. Doc, please you may continue.
Thank you. You are doing a very good job. I will later on ask you whether you are in the health center. You are doing good job. All right. Thank you, ma'am. All right. So we've also seen how progesterone also contribute to proliferation of, and because of nyansa yahun say progesterone ne estrogen and the boama fibroid no enyini very soon you look at how we treat fibroid, the options over there. Odu ha ebia mu bi at some hospital or fibroid the moje to a doctor and say ye bewo Zoladex, ye bewo Luprodex. Say Zoladex no Luprodex no, and on your friend no GnRH agonist. And no a breast hormones as enudwuma no ema eba form cerebaya intimi ema feed the fibroid to grow. So that's why when you come very soon we see the management. So we just utilize the understanding that progesterone and estrogen promote growth of fibroid. That's why we use these medicines to try in attempt to reduce the size of the giant fibroid before we do operation for you, because we've already seen that the fibroid it forms its own blood vessels, angiogenesis. So those with huge fibroids, if you don't prepare well, if you go and do the operation for them, they bleed a lot. So I hope that 1 or 2 people on the call might have had myomectomy or they are planning to have it. And your doctor will say you have to look for at least about 4 units of blood and all that, because of the process of the angiogenesis. Now, you have the fibroid or the vessels are producing mojamano inti, and the mojano pump. All right. So other things that helps the fibroid to grow, because something growth factors. I think this is more academic, but it's very important we understand it, so that, because here we are looking at facts and then the misconception or the myth. That's why I brought all these things, so that we appreciate what actually promotes the growth of fibroid. All right. Now, the current evidence, emerging evidence suggests that fibroids originate from abnormal myometra or stem progenitor cells. Genetic mutation in these stem cells leads to abnormal proliferation, increased collagen production, and formation of fibroid nodules. Research, aside the smooth muscles now you see and on fibroid say progenitor cells be uterus no more now the genital tract emu enona say mutation genetic mutation as insistent be above. That's why the environmental lifestyle modification, so all those things, they become a precursor to trigger some of these mutations. And once the mutation starts, then of course it results in abnormal proliferation, increased collagen production, and formation of them. So this is some of the current evidence trying to explain why we develop fibroid along the female reproductive system. Right. Now, yes, this is a fibroid no emoja operation emoja 2. And when you need the more reason why we do say you must be our fibroid ye ko yes amano o catch doctor say, oh doctor, now ko yes and the fibroid mamia. And normally ye ko yes now fibroid I am for yen I just said at my operation be brave baby I say we try to we akola no fibroid missed and no dear ye ma ho kwan say, because it says when try to when you fibroid no untimi enyi akola de no dear ye ma ho kwan say yi fibroid no na yi akola no ba enye saa emre pii no ye mpese wo fibroid a ebe ye CS na ya sien ayi fibroid no emoja be two be because of this process of what angiogenesis. Because fibroid no or no so the blood vessel feed no baby no so once you are pregnant, a lot of blood also goes to the uterus. So if you are pregnant and you also have fibroid, it will be unwise for any doctor to be doing CS for you and then unprovoked. The fibroid is not in his way, and say, oh, me fibroid. But obi wo ha wo plan year na wo ne anesthetist no ka na ɔte aseɛ na se emoja wo hɔ na ɔte aseɛ obetuma plan sɛ oh ye koye CS amount by CS na ye be fa so na ye yi fibroid ye da ba no ɛsɛ wo plan yie ɛnyɛ sɛ one plan yie na fibroid no eni baby a be ya akora na fie no fibroid ensi hɔ is ni baby we see oh no dear it's not allowed because of this increased blood supply to the uterus ebema unipa no everyday and all. That's why I intentionally brought this concept to try to explain it to you very well. All right. So we've said a lot.
Let me quickly translate what you have said and then we can continue. Thank you. Doc, fibroid ba genetic mutation alo nibi nekanji boni the whole ebobu nibi komani ebolewu alo ni yogbomotu amidi enche ba anya ni ehani neke genes na atake ni eke fibroid ba ni angiogenesis say egbulami ojugban ehani wonu sisua akesin ni fibroid ye ledi enche ifangin ni ekeda ni ehani fibroid na ala ni ekeda ye musune mi hewo kaji ohia musu ni abase busi yes no ye fibroid na ekwe doctor ko be ni ebaji fibroid gbeken fen ta any fibroid ka trigbeni anye agri gbeken dani ekeni ne ba tahi ewie na kan ni ekake ejake amesiole na kan ejake beni ohia musu na kan la ya opomoni ahi ke hagbeken edale ewo ke ayata fibroid here labanye ahobua hu ni na gbe eyafin ipapa ni ehani wonu hwisia kesin ke doctor fonyoko ba sumu akeke eba sebusi ese eba gie o fibroid ke fita here be na kan doctor etashike anesthetist nya mesutu he ojugba agbene hu ameyela ni kaji ale no ni ebon se money la hubo amebanya mehabula oni eke complication ko akaba ewo na kan ja ame plan ojugba dani ameba se na kan doctor fonyoko be ni eba tishin keke akeshin o fibroid o ya for abase bu CS wo e ba agbabu ni egi fibroid e ka bi fa bi le dabi.
Hello, can I be heard?
Hi. Yes, please.
Wonderful. You are doing a good job. Wow. All right. So from all that we've learned, so why is this conversation important? So far, I think what we've learned is very important. So, uterine fibroids are a major public health concern from the little where we've gotten to, because they are among the leading causes of gynecological outpatient visits, hospital admissions, myotomies, hysterectomies, and then iron deficiency anemia and reduced quality of life. From what we've learned so far, we've seen that consulting room. Meanwhile, ya any part patients and move 5 L fibroid. And oko kwebu the same thing. Me adwuma so ho. Oko Rija and the consulting room make the same to all the gynecological outpatient department, you know. So who friend says ya on nyina beka say doctor bia out one patients who ye emu beye idea on nyina on fibroid. And I know so most of them no admissions ebobu of her or beba no obu ni nsa emoja tu ni saa obu ho beba ni HB no drew 4-2. I just say your man emoja because of the stem because fibroid breathing. And obu also because of fibroid they say you pray for myotomy. Obu okra say because of fibroid means say ye awodie no ye awodie na ye friend no hysterectomy. Ana ye friend be iron deficiency anemia. The fibroid means emoja tu no betumi anya anemia. And of course, say So ubu sana emoji to cry, you will not feel comfortable, so there will be reduced quality of your life. Yeah. And also fibroids is going to affect reproductive health. You've seen it, your physical health, your mental well-being. This last week, Mami Biba Menim no say, oh, fibroid no air sano. I'll see Ubishia no, or say, oh, yeah, the Yamiasi. Now, Ubisan Sada, the Yamiasi, so say, on him. But only Mamma so Casan so, Sabio, Manimo, or Moda. It will be our Moda. Fibroid into the fry can see Obiashi and also Yedinyamiasi. You can imagine her mental well-being and then the what it will do to her health will be our own order. Fibroid to a fry can see Obisha, oh, Onyam Yedinyamiasi. So you can imagine. So it has got its mental, it affects physical health, reproductive health, sexual function, family relationship, and then of course, economic productivity. So, fibroid at the end of the month, I guess it will affect economic productivity as well. And then this conversation is also important because a woman with symptomatic fibroid, chronic fatigue, as we explained, anemia, of course, recurrent hospital, there be a just of course with near Joe tour. We've talked about all that. It's also so delay presentation may result in anemia. And the only fibroid, or fibroid, or banal cancer noa, or say mequaba. Ubehuni biem na ekasie. Ubehuni biem na emoji tuna when anemia waba or Ghana emergency. So public health education is essential, and the area is very important so that we know the fibro the deba. As soon as it's and that's why I've taken my time. Though this is not a typical university or medical school lecture, but I've taken time to give us some of the scientific basis about the courses so that we appreciate it, and then we know it's not spiritual, at least, so that we can report to the hospital at the right time, and then we can intervene, and all this will improve women's reproductive health and quality of life. The question is, when at risk of durable fibroids, and the at risk of having fibroid, no, you will be beer, you won't mean any BBR. Your cancer non-modifiable risk factors are won't mean you won't be BBR. Instead of your ball fire, no, Sana out here, and the BB also swap, ubet me, I won't be, and non-modifiable risk factors. Indeed, the ain't me and you won't be beyond say, ye be patuntum. Sana Yango boy, and I say, young Crawford now on Caribbeans and then African Americans. Own to me your own fee, son of Yanko Ball. Anna, baby a war tour, where Bushnaqua free will say, oh, mammy or fibroid. Now, we near man more fibroid, and the chances of you also getting fibroid is because of genetics is very high. It's very high. But it doesn't mean, say, oh, mammy or fibroid. Now, we near man or fibroid, I also being a fibroid. No, that one is a myth. You may or may not, but the chances of you having it is very high compared to somebody Nima Minibi, Abusian Mobi, or no better, but it's very low compared to who our mommy will be, our man will be. The chance of you getting it is very high. But that doesn't mean say a much time I'll be no, but your chances of getting it because of your non-modifiable risk is very high. Anna, me said if you as a kind, normally, Nippon fibroid pan on between 30 years to 50 years because of because of the hormone levels. But people in we have a few people 24, 20, 24 in their 20s who have fibroid. We have quite a number of them over there. Yeah. And then, Ubia Ubun in Santem, when we say early manaki means the first menses is what we refer to as menarche. And it's a ubu and say abodium ayushmu say your mama no umbu on centum. It will be a boon in centum no or no so you say the panels also a bit about say ubeting and your fibroids. So these are some of the risk factors. Anna Obia when you pass so and wow back one aminu and I say on walk rather. So the young consulting room chairman for say oh as I said that now on fair yeshua if the same principle and he say I would the end of that now on fair yam and now say onyam back one aminu and also it promotes it's also predisposed you because it's one of the risk factors for fibroid. Of course, as it's in genetic susceptibility, say, oh, mommy will be abusianum, and my woman now of fibroid. The chances of you getting is very high. But as it means, say, on the subenya be bad compared to Ubia abusianum or Ubia nibino, or risk no, very high. And no, yentimi ye ho hwe eno ne ya body but the betimi aye ho bibi e friend modify risk factors no obesity CIKCP eno no ya hu say dia ebuama fibro ni no ne hormones not onwa onso pi no so no na ye hu so say ovaries no and they produce majority of the hormones no ovaries. But you must say on no the fat cells no peripheral no they can convert some of this thing, they can produce some of these hormones aside what the ovaries will produce, they can also produce some outside the ovaries. So to CIP so no a bit yama ana on hypertension must be also due to other pathophysiologists. And obesity, vitamin D. It has been shown that chronic vitamin D deficiency can also increase your risk. But we are not saying, say, obia or obese, ni more to be a fibroid, no. Obia or hypertension be a fibroid, no. Obia or vitamin D deficiency be a fibroid, no. But it just increases the risk. It increases the risk. But we have plenty of people who are obese, they don't have fibroid. We have people who are hypertensive, they don't have fibroid. We have people with vitamin D deficiency, they don't have fibroid. So, CSR. And then, diet high in red meat, on processed food, a citrate, and your friend of junk food. And say in running now tidy dinner and number brain, it will increase your risk. And then own di and diama any habamono low intake of fruits and green vegetables, they are all risk. So it means we can reverse it. It means if a modifiable means we can do something. So we should reduce our weight, we should control our BP. When you have BP, take your big medications. We should eat food containing vitamin D. And we are lucky, our part of because of the sunshine, we also avoid excessive meat and then avoid processed food. And then we should eat a lot of fruits and green vegetables. And then as Madam said it seems as if Madam has a copy of this presentation, or say physical inactivity. Waka Madam catch her and see, yeah, internet yapum kakra, and can say, Gidigidu, sorry, and now Nante, and also say the Onante Nante kakra now say, we are doing our office cry, what's not about 1 hour be and what. So we are doing a groom. So if you are at the market sale, don't sit the whole day sitting at one place and now you are eating some of this unprocessed food, processed food, it can also increase your risk. So yeah, internet yapum by and can say sorry na ko gym gidi no nanti cry yapum tintene the old say we masa asakra be much no problem say we adware won sum kra ni nyina aka ye kasa titiri wapomu a ni nyina aka ho bi ene onwo a memfa nse onnom nsa ensa no de onwo a onnom bie no na onnom bie pa no ana eno so ni nyina is a risk factor but yen ka say obu ho a every day obe take 10 bottles of beer onya fibroid and nye say onum beer onum sapa, it's just it increase your risk. That's if you have the non-modifiable risk factors and it's not showing, and you add this to it, then of course it makes you to increase your risk of what developing the fibroids a lot. Of course, I've already said that too. Yeah, please, I'm listening for me.
Translate and then we continue.
All right.
If I know Hesibani, Doc, area noni he woni sani noni wakasi one wabali. Honey one nutrition keshi it's a major public health concern. At a quality hospital, quality ops and gynae unit. You ya be a back wakashimeni akwena kan bile pe corner crowd bana metamo 5. Ni ameyeneke hilane ko ni trakashime pi yako. Honey one nutrition keshi ni ebalena kan hewo ni bi kumenye alo ni bi kumenye ni neke fibroid ne banya ni ikeba ni ekomenji akela ba hobuwa ni ehani ola abashi ni ewia kashi ebanya hu ni afebu ehani afebu operation eja ka fibroid e ko na be pi eja operation tani abaji ni myomectomy agbene hu ebanya ni hani aje ofomoni efe ni hysterectomy ni ebanya ni ehani ona iron deficiency anemia ni trake ola baba shukra ni iron ni yo ola ni efa ni no hu a reduce or quality of life onye ni oya no babo ni oba asuma ke oya ni oba eja keke da bilan hubu ni ewo here onye ni ohusibo ni osmo e affect or reproductive health akeni oba fo hu e affect or no hu o physical health gbogbo mo tumu efe ebanya ni affect no dane etobo ejake ola ebashin onye ni oya ni obabo ni osmo o mental health being alo mental well-being akeshi ubana jamoni kashifa ni onye okachuni ni onye oya no ba no hu ebanya ni affect ekeko na ko no ya hospital mla no hu banya hani fibroid ada senini agbene hu ola ba bashinkra ni ja ahabula dani ebahi ni ka ahabula akose ni ofe henu kwela ebasa ebashiku agbene hu ake ubana musundie ebawa ejake tamoboni etrohie ekewo ke fibroid ye jeme be kume heni sani abifa bile aka jeme ji heni fibroid kan wo ko na musuno keke efu ni ehani wona wonu hihia ake no ni wo fi one ehihia wa agbene hu eke ni bi kume ni banya ni ehamuku ana fibroid ajami enyo ekomie noko benu banya ofe ye no ni noko benu banya ofe ye ji ekomenji heni oje alo oreals ni hani wonu hihia aka wo african ye aka wo ba na ekwe eyenwenwa na kanji boni ekashi noko benu wo banya ofe ye agbene hu ekoye wekumi ni ekole o mami na ekoda onyami kwe na ekoda o anti kwe na ekoda o na kwe na ekoda no hu akabu hu ba na ekwe eyenwen shinu etwa akashin ken o ba na eko ehani wonu shishin akashin increasing reproductive age tamoko o she hekoni sani onyo for aka between the ages of 30 and 50 years na kan be ami hu no ko be no ba nyo fe ye jake da le nyu mo na wo fe wonda e wo ko hye na kan be ami akoba na ku high agbene hu kaji obon yi ani fe momla no hu obanye ni increase or risk akoba na ke fibroids na ku yo ni pokuda alo efoku pie amehu ameye risk aka ameba na ku na agbene hu genetic susceptibility ni keke ekuye ola miye alo nyeweku miye mukuye kuye miye akoba na ku ye high wa shinu etwa atesiken obana near one can be kumay risk factors say kumay no wadi and show banya watching heni when you walk na in no can fibroid nego eco give obesity aka oda fenini oshia obesity eco hypertension kwaji oye BP hela no no heni be o risk akobana fibroid hela na ba bashin ewie ho aka vitamin D deficiency ni hani wonu hihia aka heni wo yo na le vitamin D na mo ewa kra ke hawo because of vitamin D bashin be no hu obanya ni oneko ni wo yo ni low red meat fire me a low processed food na kan indomie na ni ba na aka ye amo ni ye chins ni kana kan ni bi efe enyo increase or risk akọ obana ne kan fibroid hela na eko ni kaji oye adwa wai ojugba ke green vegetables say ne kan ni bi na efe increase or risk coffee exercise da na otahe kome oni chumo ni otun ekole otashia hani wonu sisia ke ko otashi fiwe oteshi oya nyenye fio oba tashi kun ochano ni ofio no ni agbene hu pe onu oda dan piye ni ke bi etiti eji onu no hu increase or risk ni hani wonu sisia ke shi kaji oye neke non modifiable risk na eko no ni onye hekwo si ni no ni obanya hekwo si e ba sika here be buele ka kwe na hi onna neke hela na eko. Thank you. Doc, please, you may continue.
Thank you. Oh, you are doing so well. I'm grateful. So there are other things that can also protect or reduce the risk of one getting pregnant. So it's more like reverse of the modifiable risk factors. So normally people who has given birth 4, 5, majority of them is protect them from dropping uterine fibroid. Even if it's there, at times you see them just minor ones or small ones. Then we have also when you are breastfeeding, also it reduces the risk. And then as we've already indicated, regular physical activity. And then of course, we say we should keep a healthy body weight. And then diet should be rich in fruit, vegetable, legume, and whole grains, and of course, adequate vitamins. So if you abide by this, these are some of the factors that if you don't have fibroids and then you do some of these things, and then it may reduce your risk of developing the fibroids. But we've seen that you can do all these things. If the risk factor is there and the environmental factors, you might also, but if you do this, it protects you in the way reduces your risk. All right. So what are the common signs and symptoms of fibroids? And we've already mentioned them, so we'll run through fast because time is fast spent. Of course, we have the menstrual symptoms of fibroids, and then we have the pain symptoms, the pelvic pains. With the menstrual symptoms, you see the heavy menstrual bleeding, prolonged menstrual period, and then intermenstrual bleeding. Then, because of the fibroid, the way they are located, we've seen a diagram, they can cause pelvic pain. And then during your menses, dysmenorrhea means painful menses. It become painful. Then chronic pelvic discomfort and acute pain. And then there's something what we call degenerating uterine fibroid. We've already seen that the fibroid, it has its own blood supply. So if the fibroid is not got adequate amount of blood supply, then become degenerating, and that one to cause a lot of pain. So most people will come with fibroid, they will come with pain, and we call that one pain from degenerating. And then the pedunculated one we saw, it can twist. When it twists, then we say torsion of the fibroid. Then some of them, we've already seen the pressure symptoms, and then the reproductive. So depending on the location, fibroid can cause infertility, recurrent pregnancy loss, and then implantation failure. And then in some people, we've already seen that depending on the location, it can cause breach. Instead of the baby will come in with the head, if the fibroid is occupying the lower uterine segment, it can result in malpresentations and also, as already indicated, preterm labor. And then after delivery, because of the fibroid, a lot of fibroid in the uterus, So a lot of fibroid in the uterus after delivery can also cause it called the postpartum hemorrhage, primary postpartum. Fibroid na wa would get munti or we are uterus need contracted into emoja betu so fibroid no as soon as for ebino. And I've also indicated that the fibroid, because of the location, when it's lower uterus segment fibroid, then we have to do cesarean section for you. So these are some of the issues with fibroid. So we've seen the stomach manifestation there, anemia, weakness, and all that. And of course, I've already talked about the psychological and social effect, the depression, and all that. Okay. All right. So the burden of fibroid, how the further affects globally and Ghanaians, it seems I've already mentioned them. So I'll share these slides with you so that we've already seen all that. So because of time, we skip. And then, so how do we diagnose fibroid? So like, Arabia, no, to hospital, see a bonus or fibroid, no, Unya ba, Obeka, the Antioba, no, Obeka say, oh, nine sign, Mahun said, be a fun air cassia. And now say, first, no, let me booming star, not about 2 days. First, let me use one sanitary pad. But I say, no, I get mean to me, use sanitary pads, me use even diapers. And now say, be a fun air cassia. And now some of them, they will present with fertility issues. And then, so basically the history, we take history. And it's not about hospital, it's on some you know. And so some of the history, babies are on some about, so who boon sa, a bassa de a baby bray, a bear nahi, and ya, ubu say, a yo ya, and I say, what is our CEO ya, and now Johnson 10 do. And I say, seasons of count, that's one to recur, obedience go home. That's what we call agency. And now Johnson term frequency. And I say, want to be Oyam to me team, if your baby a fiber listening to, said the Yahuno, it's pressing against the rectum, so it's causing constipation. Then we take a thorough history, and from the history, now owns the Akasa or Bedahona, yen field, Yabesha, Umoja and Swati. You better from a freeze or through copemo form near Hester or Yemono. At times, some of the fiber, when you see straight away, you can see that some of them are as big as a baby who is about 36 weeks. Some of them can be very big. So, straight away, even medical students, once they see, no, this just fiber without even touching the person, it's obvious. All right. Now, a dear investigation. So, the common investigation after examination is scan. The Ebekase could trust scan. So when you do the scan, then of course, the scan will be able to, we have different type of scan. We have the 3D scan. Then the scan will be able to tell us the location of the fibroid. And then when we do, and in some, we don't normally use the MRI, but in BBA ester fibroid, we call it adenomyosis. It is a scan, no, you suspect adenomyosis. Now scan, no, the information I have. And so in some, nipa baako bi wɔ hɔ a yɛbɛma wɔn sɛ you move from the scan to do MRI but routinely ɛnyɛ sɛ ɛyɛ use MRI no just nipa baako bi yɛpɛ sɛ yɛte biribi ase a but most people know about over 90% when you do the scan or we can even take the fibro just on examination so we just do the scan to confirm it. Okay, all right, so those with infertility issues, we want to see whether there's a fibroid within the cavity. Then we do what we call saline infusion sonography, hysteroscopy. Before I bet me the affair, I would be fibroid BBC, baby, a plan better near year through. And yes, I want you to talk to a and best say. And if free BB, I'm saying, Mumubu, how my bida, your free BB HSG or hysterosapingogram. And also, see a year. Ebetimi fibroid maybe or baby ewa would be more ebetimi actually and a blood test we use blood test no and diagnose fibroid no by a who's a fibroid ebetimi anemia umoja so betimi ati and obi wo ha so ba begin say fibroid e bi kura na or fibroid no so na onyam eka ho nti ebi wo ha depending on the history you bet my pregnancy test you bet check o umoja dodo no ana ye hu say fibroid say ebia because of location of the fibroid no ma Johnson ntimi mba yie nti so Johnson the ba be assign back to the kidney so depending on the location of it can also cause renal impairment. So side if we want to do renal function test and obu o emoje tuwa the ebema ebi won so aside fibroid no na your fibroid be thyroid function your thyroid level no say hormones no ye low so a it will emoje no too so obu o ye we nyina e dey support but none of these laboratory tests we don't use to diagnose fibroid. They are just supportive investigations, but so we don't use this to diagnose the fibroid. Okay, so treatment options for the fibroid. So the treatment options, or fibroid, the treatment is no symptoms. Say fibroid into ultimate and I say moje 2, and I say fibroid into wayasi or ya, and I said depend on the symptoms. Anyone fear what Anna can see the size and the location of the fibroid. And I said, what we and I say, Upeso will be my nasa and I say, I can't crab in wet menopause, and I said, the open Anna, yeah, mount. So these are the things that we look to. Then, based on this, then we know the appropriate. So, based on the symptoms, your age, the size and location of the fibroid, your fertility wish, and your proximity to menopause, and then your preference. So these are the things that we look, and then we know the appropriate management for you. So based on this that I've mentioned, then the management for fibroid, because something watchful waiting or expectant management, and no, the fibroid is na unya esunsun sansubia and how. And I say, what drew menopause, and I say, we are drew menopause, fibroid to be a dream, our drew cry, emoji to and your behavior. You see, a quiet scan, you whom fibroid be. I don't know. Young my friend, watchful waiting or expectant management. Just every 6 months, the best be scan, near the fibroid, no, and I say, a year, I did say, if it's here. So that's one. Now, the another management is the medical management. And no say emojano A2 bibra. Ebuwa yema wendra ebema emojano etra. And I say ebema fibroid no ayeketwane ayi operation amount. So the medicine we give you just to reduce bleeding and then to improve the anemia. Obuwa because of the fibroid no nimoja nyina awe. Inti ye wono empane se de beya umunin sabium so the beya betimi are building blood level no na yaye operation amano. So that's the medical. And then the fibroid operation, as we all know, is what we call the myomectomy. So fibroid operation is called the myomectomy. And then now the myomectomy say no encounter no na you open abdominal myomectomy, but I say no we can do hysteroscopy. Depending on the location, we can pass instruments through the vagina, through the uterus, and do it, or laparoscopy. We can make just small incision under your belly buttons and remove those things for you. Anna, but the definitive treatment, you know, say you be our DNA, and normally will be our we're doing the menopause, and now I want the men in every nasa fibroid into much day to noa. And who he say you be your nance say 2, 3, 4 hours, you acquire fibroid operation a manner. Into your name, I want the men in every and a fibroid nose also air tietino, and memoje tuno every month be I see a command in moja. And you know, the another car, you know, yetimi our diano. That's hysterectomy a manner. Okay. And then these are some of other management options for fibroid because of time. So the preventive measures, we've already looked at them. At community level, that's what we are doing this presentation today. And then so now the last chapter of today's presentation, fibroid, the myths and then the facts. So the first myth is fibroids always cause infertility. and it's a myth. It's not true. So the fact is, most women with fibroids conceive naturally and have successful pregnancies, and only about 2 to 3% of infertility we can attribute it solely to say where I want our own because of fibroid. It's just in a minority, very, very minute fraction. And then infertility, the causes of infertility due to fibroid depend on the location of the fibroid. We've seen that the size of the fibroid, number of fibroid, and how the fibroid distorts the uterine cavity. And we've seen that submucosal fibroid have the greatest negative effect on implantation and pregnancy. We've seen that. And then another myth is only older women develop fibroids. It's also a myth. It's not true. It's not entirely true. So what is the fact? So the fact is that fibroid may develop from the late teenagers. So we have people in their 18, 19 can have fibroids, but it's not as many and as giant as what you may see in people in their 30s because of the reason that we've given. Yeah. So because of that, and then we said the peak incidence occurred between 30 and 50 years, and then women of please, I'll be with you very soon. So that's one. Yes, I'll finish very soon. Okay. So women of African ancestry often develop fibroids 5 to 10 years earlier than the women of other ethnic groups. And then all right. So I think because of time, I'll run up and then share the slide with you. Maybe we can book another day that will be convenient so that I finish it up. So we run through. So in conclusion, we say know your facts, not the myth. And fibroids are common, treatable, and usually benign. And early evaluation, evidence-based management, and informed decision-making can preserve health and fertility and quality of life. And then once again, thank you for your audience. We thank God for this opportunity. And we thank the CEO of St. John's Hospital and Fertility Center, Mamiya Efiyi, for giving us the opportunity to come and give you this presentation. And as I said, I should have taken my time and go through, but because of time, I have to rush through this presentation. And these are some of there's a well-researched, so these are some of the presentations. Thank you very much.
God richly bless you, Doc. God richly bless you.